Neck pain, stiffness, that nagging ache that just doesn't seem to go away? It's something so many of us deal with. But have you ever stopped to wonder what's actually going on in there? Well, today we're going to break it all down.
So if you're someone who's felt that constant discomfort, maybe some weird tingling down your arms, or even headaches that seem to start right at the base of your skull, well, you're in the right place. We're going to get to the bottom of it.
All right, so here's our game plan. We're going to kick things off with what this thing actually is, a pain in the neck. Then we'll dig into the causes and risks, what the symptoms are and how it gets diagnosed, what your path to relief looks like, and we'll wrap up with the most important part, how to prevent it.
Okay, first up, let's demystify this whole thing. What are we really talking about when we say cervical spondylosis? Let's break it down.
Okay, so cervical spondylosis sounds super technical, right? But really, it's just a general term for the age-related wear and tear in your neck. Think of it like getting wrinkles or gray hair, but for the discs and the little bones, the vertebrae, in your neck. It's not really a disease, it's more of a process that happens over time.
And just how common is this? Well, it's incredibly common. In fact, most people between 40 and 60 start showing some of these changes on scans. And get this, a lot of them don't even have any symptoms at all. It's just a normal part of the aging journey for so many of us.
So if this is just a natural part of getting older, what are the things that can kind of speed it up? Why is this happening? And are some of us more at risk than others? Let's take a look.
Okay, so this is where it gets really interesting. Yeah, aging is the #1 driver, for sure. But look at all these other factors. Our modern lives play a huge role. That whole tech neck thing from staring down at our phones or laptops all day, that puts a crazy amount of strain on our necks. Then you throw in genetics, maybe it runs in your family, lifestyle choices like smoking, which actually starves the discs of nutrients, or even a past injury, and boom, you've got the perfect storm for speeding up that wear and tear.
And this is how it all goes down. It's like a domino effect. First, those little cushions between your vertebrae, the discs, they start to lose fluid and get stiffer. They're supposed to be our shock absorbers, right? So when they shrink, the space between the bones narrows. Your body, being smart, tries to fix this by growing little bone spurs to create more stability. But here's the catch. Those bone spurs can end up pinching the nerves that are trying to exit the spine. And that's when you start feeling the pain, the tingling, or the numbness.
Okay, so we've seen the mechanics of it, but what does that chain reaction actually feel like? And how can a doctor be sure that this is what's causing your symptoms?
Well, the #1 thing people feel is, no surprise, neck pain and stiffness. But remember that nerve pinching we just talked about? That's what can cause pain to shoot down your shoulder and into your arm. You might also get those nagging headaches at the back of your skull. And that numbness or tingling or even some weakness in your hands. Yep, that all ties back to those pinched nerves.
Now, it's really important to mention this, even though it's much less common. In some severe cases, the spinal cord itself can get compressed. This can lead to bigger problems, like issues with coordination or even difficulty walking. It's not to scare you, but it's exactly why getting a proper diagnosis is so important.
So how do doctors figure this out? Well, it usually starts with a physical exam, checking your reflexes and all that. Then they'll likely want to take a look inside. An X-ray is a great starting point. It's perfect for seeing the bones and spotting any of those bone spurs. But if they really want to see what's happening with the nerves and discs, an MRI is the way to go. It shows all the soft tissue, like if a disc is bulging and pressing on a nerve, and a CT scan, that gives an even more detailed picture of the bone.
All right, so let's say you've got the diagnosis. What's next? Well, here's the really good news. For the vast majority of people, the path to feeling better is all about conservative, non-surgical treatment.
And I want you to pay close attention to this, because it's the most important takeaway. Just look at the size of that first bar. Physiotherapy and specific exercises, that is the absolute foundation of getting better. Right after that comes fixing your posture and making some lifestyle tweaks. Medications and injections, yeah, they're helpful tools for managing the pain, but the real, lasting solution is all about movement and building better habits.
So let's just make this crystal clear. Surgery is not the first stop. It's really only for those severe cases, especially when there's that spinal cord compression we talked about. For almost everyone else, the goal is to relieve pain and get you moving better with conservative treatments, and honestly, they work incredibly well.
So what's in your toolkit for when things flare up? Well, you've got a few options. Simple over-the-counter pain relievers can help a lot with inflammation. If the pain is really bad, a doctor might suggest a steroid injection to calm everything down right at the source. And don't forget the simple stuff.
A heating pad or a cold pack can feel amazing. A soft neck brace can also give you some temporary relief, but, and this is a big but, you only want to use it for short periods. Overuse can actually make your neck muscles weaker.
Okay, this brings us to my favorite part, and honestly, the most powerful one. How can you get ahead of this? How can you take control of your own neck health?
I just love this because it's so true and so empowering. You can't stop the clock on aging, right? But you absolutely can reduce the amount of wear and tear your neck goes through. It's all about working with your body, not against it. All right, are you ready? Let's try one of the absolute best exercises you can do for your neck. Right now, wherever you are, sit up nice and tall and try to get your ears right over your shoulders. Good. Now, take a finger and just rest it on your chin. Don't push. Okay, now, without moving your finger, I want you to gently pull your head and chin straight back, like you're trying to make a double chin. You should feel a nice little stretch at the base of your skull. Now hold that for 5, 4, 3, 2, 1, and relax. How did that feel? Seriously, doing just 10 of those every day can be a total game changer for your posture.
And to wrap it all up, let's build that healthy neck routine. The goal is to always keep your head balanced right over your shoulders. Think of it like a bowling ball on a stick. Pull your phone up to your face instead of dropping your head down. And try the 20-20-20 rule. Every 20 minutes, just look up from your screen at something 20 feet away for 20 seconds. It gives those little neck muscles a much-needed break. And of course, staying active with things like swimming or yoga is fantastic for your whole spine.
So here's the bottom line. Your spine was designed for movement. It craves it. But we live in a world of screens that's constantly telling us to be still and look down. So the final question I want to leave you with is this. How are you going to move yours today?